We are quickly approaching open enrollment when we all decide our health insurance for next year. And thousands of folks 65 and older on Independent Health's individual Medicare Advantage plans just found out that Roswell Park will no longer be in network. Now, this does not impact Independent Health's other plans, but it is a significant change. Today, I talked about it with the Cancer Center's CEO, Dr. Candace Johnson, and I asked how patients should navigate all this. Roswell Park has basically said Independent Health came with a plan that was just unacceptable. There really wasn't much to negotiate here?
There really wasn't a negotiation. This was their decision that they were just no longer going to offer Roswell Park to this group of patients. And actually, that group of patients needs us more than ever. It's a very sad thing in my mind that this happened to our community. Everybody deserves the care that we deliver. We're recognized for this care. we're the specialists. We have things here no one else in our community has. And to deny someone access to that is really, it's bad.
I'm sure that there are Independent Health Medicare Advantage customers who are going to want to keep Roswell Park, and they will just switch to another provider for that insurance. How are you helping those folks?
We're really trying. We have hotlines. We've manned sort of phones. We have sent out letters to our patients because we want to make sure people have access to these individuals. They call them brokers that can help them switch. It's a daunting to go online and be able to do this, even for folks that are real savvy with the internet. And so we really want to provide the help that we can for these patients.
I want to read part of what Independent Health said and get your reaction to it. Despite extensive negotiations, Roswell Park chose not to participate in our individual Medicare Advantage plans starting January 1st, 2026. Is that how you would characterize it?
No, it would not. I mean, we're currently in negotiations on many other issues with Independent Health. This particular issue, there was no negotiation. We were told what they were going to do.
Independent Health says you'll still have access to cancer care at all these other providers. How do you respond to that?
Well, those other providers aren't Roswell Park, and even if you're referring us to Wilmot in Rochester, to drive 70 miles is really, for some of these patients, a very undoable situation. And also, we have things they don't have in Rochester, and so to just sort of shut those doors on the things we can provide is not fair to these individuals.
It's important for people to understand Independent Health folks who are not on Medicare Advantage still have access to Roswell Park.
They certainly do. They certainly do. And this, that's sort of the scary part of this, is if you're a cancer patient and you start reading all this, you want to know, oh my goodness, does this affect me? Is this going to make a difference in my care? And in most instances, it does not. But we're here to answer those questions, to sort of relieve your fears and be able to make some sense out of this.
And also, to be clear, the other Medicare Advantage plans, there are many in Western New York that include Roswell.
That includes, yes, most definitely.
It seems like Medicare Advantage is becoming a cost burden on a lot of the payers. Do you worry this is a trend we're going to see?
I do, Michael. I worry because across the country, these low-cost premium plans, I think, were oversold. And then these were very vulnerable populations of people that got really sick. And insurance companies really couldn't afford to keep them anymore.
The vast majority of your patients are not impacted by this, but for those who are, it's really important.
Oh, it's really important, and we want them to know that we're going to be here for them, and that we'll do everything that we can to make sure that their care is not interrupted and that they get the right care.